Thank you, Mr. Chairman. I hate to spend any of my time on this subject, but we've now had 4 votes since we convened this hearing this morning. All 4 were motions by the minority to adjourn the House in a dilatory effort to just gum up the works so that we can accomplish what we're trying to do for the American people. And I would like, I wasn't here when we were in the minority. Maybe my party did the same thing, but I consider it, and I know many of my colleagues and the Republicans consider it disrespectful to the American people. So I hope anyone who's watching would take the opportunity to call their representative and urge the Republican leadership to let us get about the business of the American people. Now, that being said, Dr. Gratzer, how many countries are there in the world?
Oh, if we looked at my geography marks back in high school, you'd know I'm not a person.
About 190, give or take a few. I'll give you the third. How many of those countries have some kind of a health plan? Do you know? They said you studied these.
Well, I've studied Western Europe and the United States and Canada. I couldn't comment on Africa and Asia.
Okay, well, let's just limit our discussion to the industrialized nations. How many of the industrialized nations in the world have some form of government single-payer health care?
Many.
Most, if not all, but this country. Is that correct? Are you aware of any that don't?
Well, it depends what you mean by single payer. I mean, I think if you take more broadly to include social insurance, all except the United States. I mean,
Thank you. That's the answer I was looking for.
There you
go.
Now,
are there instances in which government single-payer health care coexist with private insurance?
Yes. For instance, in most countries. I mean, Canada would be exceptional.
Canada is the exception. So what you and other opponents of the public option have chosen to do is single out Canada as the one example, even though it's an outlier, of the supposed plans that we're trying to model.
Well,
is there anything else that we've modeled other than hockey that we've tried to take from the Canadians?
I would point out that while you've tried to model hockey,
we have tried.
Canadians still have the advantage.
I concede that.
What was I saying? No, but hold on a second, sir. I think it's important to draw lessons, and I see your point that Canada is a bit of an outlier. I would point out, though, if you look at countries like Britain or Sweden, while you have the option of private insurance, those markets remain incredibly small because they got crowded out. And the problems are relative.
What about Germany?
Germany has a social insurance policy that's tightly regulated by the government. As you know, France has a similar.
But there's also a private insurance market, health insurance market in Germany, isn't there?
And in Canada, I should point out, you can opt out as well. You can't buy private insurance, but you can opt out and buy private service.
So the point is, we have the opportunity to follow any number of models, to do none of them, to create something that's distinctly and uniquely American, don't we?
I think that would be a good thing, but I would be cautious about expanding Washington, given the way government expansion has gone in other countries.
I'm glad you applaud our effort. Now, I want to get to this issue of 120 million people who would move from a private plan to a public option, supposedly, the Lewin report. Was the Lewin report based on an analysis of the discussion draft that we have before us now? Does anybody want to comment, Dr. Hall?
Yeah, I would. I mean, no, it was done before this draft came out, obviously, but there was a lot of assumptions in there that got them that high a number. I mean, there were no exchanges. They made a big assumption about the difference in administrative costs. They assumed that the plan would pay Medicare rates as opposed to Medicare plus something. And there were some other issues that I can't recall. But it was, one of the things that I think was very important is that they assumed the private system would not respond at all to this competition from the public.
So it's fair to say that that analysis and that projection has nothing to do with the document that's before us. When the representative from the Lewin Group was here, he mentioned the same thing. He said 70-something% of the American people are happy with their insurance and they prefer to get it from their employer, and yet he also said that 120 million people would move. And I asked the question of him, well, if they love their plan so much, why would they move? And he said, because it would be cheaper. Is that your assessment, Dr. Gratzer, that that's why they'd move, because it would be cheaper?
That's the way it was designed. I mean, that's Jacob Hacker's original analysis, sure.
Is it your contention, or is the implication of that all insurance companies do is compete on the basis of cost? This was a point that was actually made by Mr. Blumenauer and others.
Of course not.
So, of course not.
Of course not. I mean, there's also quality issues, for sure.
Right. And if it were just a matter of cost, then the implication would be that the insurance companies are basically overcharging if the government create a plan that would provide the same service for less money, then the implication would have to be, or the inference, that the insurance companies were overcharging.
No, the implication is that the federal government doesn't play fair in price controls.
How would the government be able to price control? There's nothing in this bill that forces a doctor to participate, is there?
As with Medicare, one sees that price controls can have an enormous impact, and you can provide cheaper insurance. Be careful what you wish for.
Hey, my time's up, Mr. Chairman. Thank you.